Hey, this is Anthony Davis with Health or Hoax, and in today's research highlight, we are going to look at an article called The Frictional Properties at the Thoracic Skin-Fascia Interface, Implications in Spine Manipulation. So this is a really interesting article. I am a chiropractic student currently, and we're learning certain aspects of how to mobilize joints that involve the theory that essentially we can push on certain parts of a bone in order to push that bone in a specific direction. Now, in order to do that, if you just kind of think about this for a second, if you wanted to move something in a specific direction, any physical object, in order to do that, you'd have to have sort of a grip on that object, and that we're just going to describe as friction. So that friction allows us to make contact with that surface and then decide, do I want to push this object up or left or right or forward or down or any of the any available options in three-dimensional space. However, if we think about this, if hypothetically we were to push on a surface and that surface were extremely slippery, then you wouldn't be able to necessarily control which direction you pushed the actual object. You could only apply a force perpendicular to the plane that is frictionless. Okay, so if you have a frictionless surface and you push on it, you can't necessarily push the actual object to which the surface belongs. You can't push that object left, right, up, down, whatever. You can only push it away from you. That's it. That's the only option. You can only push it in one direction if it's frictionless. So, this article was seeking to evaluate whether or not it was feasible to take a hand, your pisiform, for example, or fingertips, or your thumbs, it didn't look at all of those contacts. It only looked at a few contacts, the size of the hands, really. But the point is, it looked at whether or not you could take part of your hand, put it over the skin, for example, on the back, in the thoracic area of the spine, contact a specific area of that vertebra and push on it and push it in a certain direction. So in order to evaluate that, the outcome measure they were trying to look at was basically if there was a frictionless surface or if there was a frictional surface. So if there's friction, then you could actually get a hook on that bone and push it. But if there's no friction, then you can't hook it and push it at an angle. You can only apply pressure from superficial, from the skin level, deep. So from superficial to deep. So essentially they set up some mechanisms. If you want to have good details, please just read the paper. It's fairly in-depth and I can't possibly summarize all the details here. So essentially they made a contraption where they could systematically apply force over the thoracic spines of participants of the study, and they were able to evaluate whether or not the skin-fascia interface exhibited friction or not. And their conclusions, unfortunately for some manual therapists or chiropractors or physical therapists, was that you can't. It's frictionless, so you can't hook a bony process and you can't push it in a specific direction. So the implications of this are many. If this is truly a frictionless surface between the skin and the underlying structure, so between the skin and the muscles, or in this case, more specifically, between the skin and the bones, if that surface or interface is totally frictionless, then when you push on it, once again, the only possible force vector is from superficial to deep. So some people have they claim to have specific methods of mobilizing the spine, and they rely on pushing in certain directions and hooking on certain bony processes. So this could come as bad news for you if you are married to a system like that. Personally, I find this to be extremely relieving news, because if it's frictionless and there's only one possible force vector, then the implications of that are actually mobilizing the spine can be much simpler. We don't have to waste time memorizing imaginary force vectors. Instead, we can dedicate more time to simply get good at the craft, better at our palpation skills, better at diagnosis and treatment and mobilization techniques, etc. Better at patient-centered care, history taking, whatever other aspects of healthcare we can focus on instead of memorizing these untruths. Now, the other implication here is that for soft tissue work, not just bone manipulation, joint manipulation, but for soft tissue work as well, if you are taught that you can strip out muscles, or that you can apply a directional oblique force to the muscles, or if you were taught that you need to, when you're doing a ART or some kind of deep soft tissue release therapy or something like that. If you were taught that you need to push in the direction of the muscle fibers, then this paper would suggest that that is a waste of your time and effort. So instead, the only possible force, again, is compression. You can't apply an oblique force with your hands into a muscle. You can only apply compressive forces. Okay? So that would change the techniques that you would use. It would change the theory that you would be taught and that you would teach others. It would change the language that you would use in talking to patients. It would change the educational system, frankly. But all in all, I think really, as much as this sort of thing pokes a lot of holes in current theories about manual therapy, physical therapy, chiropractic manipulation, other joint manipulation, etc. Frankly, I think this is relieving. It means that the craft can be a little bit simpler, and we can just get on with our lives and focus on some possibly more effective methods and more effective uses of our time as healthcare practitioners, or for myself, I'm a student, so as a future healthcare practitioner. One detail that I do specifically want to address, because when I was reading this paper, the whole time I was reading it until the very end, I was thinking to myself, well, guys, you have to take out the tissue slack, because if you have my shirt is the skin, for example, you would say, well, of course you're going to slip off of a bony contact if you don't take out the slack and make the tissue tight first. Well, then you take the tissue tight and then you place your contact, and then of course we can push on bones. But at the end of the article, they address this fact. And what they say is that this is further evidence that it is not possible to hook onto a component of a vertebra in this X direction, or at least it did not occur in 54 clinical observations during thoracic manipulation. If a sufficiently frictional surface was present between the thoracic skin and the underlying tissue, the taking up of skin slack prior to a manipulative thrust would not be necessary. And he says, I emphasize this in my own reading here, the fact that spinal manipulators perform thoracic manipulation with the removal of skin slack supports the findings of this study. In other words, if you have to take out tissue slack, what it means is that the interface between the skin and the bone you're trying to move has no friction. If there were friction between the skin and the underlying bone, you wouldn't need to remove tissue slack. You could just push into it and apply a force to it. They further explain the usefulness of this information to clinicians. I myself see some of my colleagues who are more petite, smaller individuals who aren't necessarily used to throwing their body weight around in various types of joint manipulation. And they sometimes have a hard time generating enough force to effectively manipulate the joints. So according to the study, a lot of their effort, 29.3% of their effort to be specific, is wasted in attempting to apply an oblique force when that's not possible. So that 29.3% of their effort just goes into stretching out the skin, but it doesn't actually go into the joint that they're trying to get it to go to. So they could be more effective if they had this knowledge and they realized they don't have to push in an oblique angle. They can just push down into the joint. They can just push straight from superficial to deep towards that joint, and they can be, according to this paper, again, 23.9% more effective. The paper specifically says this suggests that efforts to apply an oblique force during thoracic manipulation may be wasted effort. So this paper in general, there's a lot more to it, and frankly, I wouldn't be surprised if we end up doing another video highlighting some other aspects of this paper, because there's a lot of stuff in here that challenges some of the dogma of many different manipulative therapies, manual therapies, body work, massage, chiropractic, joint manipulation, physical therapy, I don't know if I said that, osteopathy, etc. So there's a lot of dogma that this casts a huge shadow of doubt, if not impossibility. And so the implications of that require further discussion, I'm sure. Please comment below, because I opened this up for discussion in a number of forums, and a lot of people were very upset by this article because it challenged their beliefs. That's my opinion anyway. That's okay. Discuss what the implications are. Discuss if you think that there's a problem, if you think that this is missing some important piece of information. Share resources, research that contradicts this if you have it, and add to the discussion below. Please make sure you click the like and the subscribe buttons below so you can get notified when we release future videos. And as always, thanks for watching this episode of Health or Hoax.